Hello everyone, my name is Kumar and today I'm excited to show you a new PartyRock app that I've developed specially for psychiatric nurses. This EMR competency assessment generator creates personalized training scenarios that help nurses improve their electronic medical record documentation skills in a mental health setting. Whether you are a nurse educator, a nurse manager, or a psychiatric nurse looking to sharpen your EMR skills, this tool adapts to your experience level and specialty area. Let's dive in and see how it works. As you can see here, this just isn't another generic assessment tool. What makes this special is that it generates realistic psychiatric patient scenarios and creates customized questions based on your specific experience level and focus area. This app covers everything from basic documentation standards to complex clinical decision making in psychiatric EMR systems. It is designed to be practical, relevant, and immediately applicable to your daily work. All right, so let's start by setting up a sample assessment. First, I'll select the experience level. Notice that we have options such as nurse manager for leadership roles, registered nurse, which accounts for senior nurse to associate nurse consultant, EN, which denotes enrolled nurses, and CSA for care service assistants. For this demo, I'm going to select registered nurse. This represents our registered nurses from senior nurse to associate nurse consultant level. This choice will influence both the complexity of patient scenario and the difficulty level of the questions we'll see. All right, perfect. As you can see, the selection is now saved. Next, we choose our focus area. This is really powerful because you can select multiple areas that match your current role or areas where you want to improve. We have options for adult inpatient psychiatry, child and adolescent mental health, geriatric psychiatry, emergency crisis intervention, substance use disorders, outpatient mental health, and forensic psychiatry. For this demo, I'll select adult patient psychiatry and emergency crisis interventions, since these are common areas where EMR documentation is critical. All right. Okay. Once I have input the focus areas, as you can see, it's generating a patient scenario. We'll just wait a moment for it to finish generating the scenario. All right. As you can see, the setting up scenario is complete. And we have here a case presentation of a 34-year-old female along with her demographic details, the presenting problem, the primary diagnosis, medical history, current medications, risk factors, current mental status, recent behavioral incidents, family and social history, treatment goals, current treatment plan, initial nurse care focus. So it is quite detailed, as you can see, for setting up the scenario. Based on this patient scenario, if we scroll down, we can see that there are three multiple choice questions that have been created. Question one says, when documenting this patient's acute behavioral incident of throwing the food tray, which of the following EMR documentation approaches is the most comprehensive and appropriate? And for this question, we get four choices of answers. Similarly, there is a question two which says, given the patient's presentation and history, which clinical decision making sequence should be prioritized and documented in the initial nursing assessment? Question three says, in documenting this patient safety status, which assessment component should be included in the Q15-minute checks? And as with the other questions, there are four choices of responses. All right. So once we have the questions generated, we can enter our responses. So for this example, I've entered the choice of one for all the three questions. Once I'm done, it creates an assessment feedback for me where it tells me that all my answers are incorrect. It gives me the reasons for the incorrectness and what should have been the correct answer. All right. So, what I love about this tool is how it bridges the gap between theoretical EMR training and real world psychiatric nursing practice. Every scenario, every question, every piece of feedback is designed to make nurses more confident and competent in real EMR situations. Whether you are onboarding a new psychiatric nurse, conducting competency assessments, or just want to sharpen your own skills, this app adapts to meet where you are. If you are interested in trying this out or want to learn more about creating similar educational tools with PartyRock, drop a comment below. And if you found this helpful, please like and subscribe for more healthcare technology content. Thank you for watching, and I'll see you in the next video. Bye bye.